Welcome everyone. As you know, we're going to be studying basic suturing. So first what we want to do is kind of get our work area ready. So I'm going to put on just a regular pair of gloves, and in order to get your work area ready, you want to make sure the surface area that you're going to work on is clean. So you want to take some normal, just cleaning wipes, and you have to make sure that this area is dry. So for our purposes, we're going to clean it and then assume that it is dry. So then we throw this away and we throw our gloves away as well. So we're going to move this out of our way, and this is our suture tray. Now, we are going to open it up over here, but we are going to bring it nice and tight and closed over to our work area. Now this is dry and it is our work area. Now remember, the very first thing that you want to do, and you hope that your medical assistant or your registered nurse has done for you, depending on your work area, is that they have filled out, and you would want to go over with the patient, the informed consent procedures. Now, as we open up this, that we are going to open up always away from us. So you want to kind of touch it away from us. Just grab the very outer parts of this and open up away from you. Always got a little area, and you can touch 1 inch around it and just kind of open up always away, trying not to allow it to touch you. Now once you're in it like this, I feel that it's okay to grab just a few things just barely on top and lay it to the side so you can get to the bottom of it. But then you want to see, what else do I need for this procedure? Now procedures that are on the face really need a 6-0 Ethelon. And if they're on the chin down here, I usually put a little Vicryl, but that's in more advanced suturing that we'll talk about later. So, so it needs a 6-0 Vicryl. This is a 4-0 Vicryl, and this is a 5-0 Vicryl. So if a 4-0 Vicryl would be used on the extremities, and a 5-0 Vicryl I use pretty much on fingers or anything else that would kind of fall between that. So what I'm going to do is I'm going to open up a 5-0 Vicryl, because this is just, we'll say, a finger laceration. Sometimes the 4-0 knots are too hard, so I'm not going to touch anything. I'm just going to put it on my sterile field just like that and toss this to the side. If this was a laceration that needed some debridement, or it needed some cleanup, kind of, we could throw on a 10-blade scalpel in order to do that. 10s are great for cleaning that, but we don't need that this time, so we're not going to worry about that. And a couple other things I'll show in the video is Dermabond. If we were going to use that, we really don't need all of this, but just to show you, and also a staple. What used to be called a staple gun, but now is very small and very easy and friendly to use, just to show in the video today. Now, it's very nice to know what's in your suture kit at your facility so that you know what you might need. Now, I know that this suture kit, because I've worked with it before, has a 10 ml syringe. Now, I don't think any finger could hold, whether it's a digital block given down at the ends, could hold 10 mLs of lidocaine ever. So I always grab what I think it can hold, whether that's 3 mLs or 5 mLs. I pick a 3 ml syringe for that. Usually a finger can hold 1.5 mLs and 1.5 mLs at the bottom for a digital block. But if you're doing something else and you want to use a 5 ml, that's great. If you want a 10 ml, you can use the one that's in there. So I'm going to open this up in sterile fashion and just drop it onto my field. And that's the one that I'm going to use, so we know now that we don't need this. Now, we also are going to put some extra sterile 4x4s on this. So we're just going to open it up, like in sterile fashion once again, and lay it on our field. Now, we also have the opportunity to use lidocaine 1% or lidocaine 1% with epinephrine. Now, on a finger, nose, toes, penis, things like that, we never use epinephrine. But on fingers, since we're using that, we're going to choose the lidocaine. So we can kind of push that to the side and say we don't need that anymore. But we know that this bottle is a multi-use bottle, which is what this facility uses. So we're going to just lay this right on top of here, knowing that we need to clean that off. So we're going to kind of just clean that off, make sure it's nice and clean. And then lay it to the side. Now this would be a good opportunity to go ahead and don your sterile gloves. And you open them just like you do for other procedures. If you're an ICU nurse, you know that you have to don sterile gloves when cleaning trachs, and so on and so forth. Now when cleaning the wound, or if you're wanting to have extra things available to you, it would be important at this point, as I had said, we had moved this little blue thing. It would be important at this point to try to just gently grab these two small things and lay them you can just barely separate them with your fingernail and lay them here and here. And I say that because we have a couple of things over here that we can pick from. If you know that there's dried blood on the wound, then you would want to use a little peroxide or a little, for cleanliness, you always want to use iodine or something like that. Like I said, if it looks like the wound is really a mess, like you're just never going to get that blood off unless you use something else, use the peroxide, but always really want to try to use sterile water. So I'm going to put a little sterile water, assuming this is a fresh wound, and it'll be no problem to clean up. So now we're going to go back and we're going to don our gloves.
Okay.
So we're going to pick up where we left off, and we're going to don our sterile gloves, remembering to touch it just under here, not the inside, and slide our hand right on in here, making room for our thumb and pulling it down. Now we can then slide our hand in here, pulling it up over, and we have donned our sterile gloves. Now we may touch anything on here, and it is free to do so. Now within in this area, we do have this, which we would put over the laceration in order to keep a sterile feel. Sometimes when it's on the face or other areas, that is difficult to do. For our purposes, since we do not have a patient, I'm going to just set this over to the side. Here are some 4x4s, but we're going to go ahead and take them out. And remember now, I can play anywhere in here because now I am sterile. Now this is the 10cc syringe that I told you about that would be in here, but I don't care for it because to push a 10cc syringe is pretty hard. Another reason why I don't care for it is there's a couple of options for needles in here. Now you have a needle, you have a 25 gauge needle, an 18 gauge needle, and you have a 30 gauge needle. I believe in causing the least amount of pain to your patient, especially on a finger laceration. So it doesn't take much when you do a digital block on a finger. So a very small short needle will do the job. But to push a 10cc syringe, 10 ml syringe through 30 cc or a 30 gauge needle would be nearly impossible. It would feel like it was taking forever. So I don't do that with a 10cc syringe, nor is it necessary. Now, the needle that came with this is probably a 25 gauge syringe, and the one in here, forgive me, I believe is about a 27 gauge. So I'm just gonna move that to the side because I don't really need it. I'm gonna use my 18 gauge to draw it up. I'm gonna take the lid off, and then we know that this right here is sterile. We've cleaned it off. We turn it over, and we draw up the amount that we need. Now, there can be a helper in here. If there's not a helper, we're gonna take one of our sterile gauzes and use that to lift off. That now is no longer sterile. So then we're going to take this off, and what we'd like to do is try to keep everything in here that we can. A lot of kits will come with, hold this, but these typically do not. Then we're going to place the needle that we do want and make sure that we've gotten the air out of it and never recap the needle. So move it right here to where you need it. Now, in here you're going to find some curved needles, which I rarely use unless I'm working on an abscess, and that would be a non-sterile procedure. Why? Because it's already infected. So these are the major ones that you're going to use. Your clamps, your needle drivers and your tweezers, and then your scissors. So I just try to get those kind of ready by pulling off all their things to get them ready. Now, when you are going to go ahead and clean the wound off, you can use your fingers or you can use your needle drivers to go ahead, depending on how the wound looks, and dip in here and wash the wound, or you can do it with your fingers if there's a lot of bleeding and you need better control. So that is how you set up a sterile tray. I hope that that was helpful.